when I go over patients' x-rays, I want to show them what normal looks like. This is a normal curve of the neck or the cervical spine. Here's the back of the head and here's the jaw. You should have a nice curve in your neck. All the weight of their head should be distributed evenly between the front joints and the back joints of the spine. Also, you see the back of the head and the first vertebra and the second vertebra. See the spaces are of equal distance? That's important. When someone sits for a living, or they sleep on their stomach, or they get into a car accident and they injure their cervical spine, the cervical spine can become straight. So not only will that reduce the range of motion in the neck, but it also can put a tremendous amount of pressure on the nervous system. When you have a straight neck, you put all the weight of your head on those front joints, and if you do nothing for it, or you just take medication when your neck hurts, eventually your spine can start to wear. So you see these little spaces are where the discs are. Those are the shock absorbers of the spine and the spacers between the vertebrae. So you can see that's a healthy disc. See how this is a little thinner? Back to healthy, and this is a little thinner. So this spine is starting to degenerate. So this patient has neck pain. And most people, when they have neck pain, what do? They take medication. But you see how backwards that is. They have a structural problem and they treat it chemically. So it's almost like having a bridge collapse and then bring in a bunch of chemical engineers. It doesn't make sense. So if you let the neck problem persist or just treat it symptomatically, it'll become very degenerative. So you can see healthy disc, healthy, becoming thinner and significantly degenerative. Remember, the discs are the shock absorbers of the spine, but they're also the spacers between the bones. So as the disc gets smaller, the hole for the nerve gets smaller. So this is why patients will say, Dr. Outten, I'm driving my car for half an hour and I get this radiating pain down my arm, or I'm doing my hair and my hand is going numb, because this posture is degenerating the spine and compromising the holes where the nerves come out. So the takeaway from this is, when you have symptoms, it's okay to take medication to take away the symptoms, but that shouldn't be the end of the treatment. The symptoms are not your problem. They're the residual of the problem. So you have to address the problem. In this case, it was the posture of these patients' spine that allowed that spine to become degenerative. So everybody should be checked by a chiropractor.